Hi, my name is Shelley McEwen, and I'm pleased to have been asked to participate in this Keep Us All Safe campaign inspired by Inspire. To tell you a little bit about me, I am a West Nile neuroinvasive disease survivor. I was bit by a mosquito in 2007, and the resulting impact of the West Nile virus had significant impact on my body. Initially began with encephalitis and poliomyelitis, but I was a very sick human being and was able at my younger age, in my 40s, to fight off that virus, but not come out of it unscathed. I've ended up with a post-polio-like syndrome, very much MS related, and have had periods of time through the last 12 years where my disease would relapse and remit. I was in a remission for a number of years, but in 2018 had a very severe relapse that followed a number of viruses and some infections, and I haven't been the same since. In terms of the disease impacting my daily life, fatigue, pain, chronic disease, issues exacerbated. So I have become what many have referred to in the disability community as a spoonie, based on the spoon theory. And if you want to learn more about that, you can go look at the website, but you don't look sick. Oftentimes people who are struggling with health issues do not look sick, but their suffering is significant. So for me, my concern related to COVID-19 relates to my own health and the impact that it has on when I get another virus and the symptoms, the neurological symptoms that are already present but sent into overdrive. Of course, having lived through West Nile when many of the people that got sick with me didn't, it obviously raises a concern related to my own mortality and my own genetic makeup, and whether or not that genetic makeup impacts my family, whether this puts them at more risk as we deal with a virus that our body hasn't seen before. I'm also very concerned. My background is in behavioral medicine, social work, counseling, and health and wellness coaching. I worked in healthcare for 30 years, and my heart goes out to all of our essential workers and people that are placing their lives on the line for the rest of us, either as a healer or as a person who wants to get groceries for us, as a person who's cleaned up the room from the COVID patient that was in there before us, the bus drivers, the city police, the first responders, the RCMP, the people that are needing to be in their work to help the rest of us. So my concern relates not only to myself, but also to those people. First line of defense is always us in taking care that we're social distancing and following what the public health agencies and the CDC are recommending, along with the World Health Organization. And the second piece of that is the concern for our last line of defense, which is the people that will help when one becomes unwell, are healthcare workers who currently have a shortage of supplies to keep them safe as they selflessly go in to do their job every single day. So my concern is twofold. My reaction to large crowds is coming from a public health background, I guess, and a counseling background. My first question is, what is the reason for people going in large crowds? If I was to come face to face with someone, my question would be from 6 feet, and even then I don't think I'd feel comfortable, but my question would be, what about this directive to self-quarantine and social distance is challenging for you? What is missing in terms of the understanding? Because we can't get through to people unless we offer respect, compassion, empathy, and understanding as to what they're not connecting with. Then to make that connection real. For the young people on the beaches, it may or may not impact them. We know the COVID-19 has no discrimination in terms of age. But it's more likely that the elderly people are going to be hit harder, as well as people like myself and others who are compromised. So, can you find a connection? So if you can't do this for yourself as a young person that feels the need to be around others, what about your grandma? Or what about, finding the life links for something that could help them understand why this is such a significant time in our history and how we all need to do our part. So that would be one of the things that I'd want to ask. What I'm grateful for is that there are groups like Inspire who has a community of 2 million people. So we're reaching a lot of different people in terms of removing them from isolation related to their disability. And I think the other thing that this time has brought up in our lives is the thing that people with disabilities have been asking for a very long time. That's happened in a matter of weeks, related to, can we effectively work from home? And what technology we need, and how quickly that has happened, which supports people who are challenged with health issues, but still competent, capable, bright, and contributing members of society to become more involved once we're past this period of time. So overall, I'm self-quarantining. We're doing everything to enhance our immunity. I'm surrounded by great people, but would also like the message that this is for all of us. Keep us all safe. And keeping us all safe means following the guidelines, flattening the curve, letting the scientists have their time to see if they can find methods of helping our bodies recognize something that right now isn't recognizable in terms of this virus, and just thinking past yourself to the better good of all. And thank you. Have a great day.